My name is Adam Zolotor. I'm a family physician and president and CEO of the North Carolina Institute of Medicine. With the COVID-19 pandemic, a record number of North Carolinians are being touched by serious illness, and we have some recommendations coming out of our task force that just can't wait. One of the recommendations from our task force is to expand access to coverage for healthcare. It's clear that improved access to health insurance is critical to get people into healthcare quickly when they're sick during a pandemic. And because of the dramatic increases in unemployment, we will see many more North Carolinians fall into the coverage gap. Some of these recommendations include expanding access to telehealth. We've done a remarkable job in the last 8 weeks, but access to virtual care is not the same for everyone. It is critical to maintain these advances and build upon them, including assuring that every community has adequate access to broadband infrastructure necessary for virtual care. We also have a number of recommendations on making it easier to fill out advanced care planning documents such as advanced directives, living wills, and portable medical orders. Currently, there is cost associated with completing an advanced directive and filing it with the state, and we have recommendations to decrease the cost to facilitate access to advanced directives. We also have a recommendation to expand paid sick leave. We know during a pandemic when people have limited paid sick leave, they need to make the difficult choice of staying at home without a paycheck or going to work when they're under the weather. This challenge is magnified when people are taking care of a loved one with serious illness, and so it's increasingly important during a pandemic to make sure people have access to adequate paid sick leave. This pandemic has really highlighted the challenges that people are having in regard to meeting their basic needs. Increasing support for these types of community-based services will help people stay at home and in their community as long as possible.